Dr. Rohit Bakshi, medical officer. So today I'll be taking up pedal edema, its causes, symptoms, and the treatment. So we are starting our today's PowerPoint. I welcome all of you into today's session. So what is pedal edema? Firstly, we'll be taking up its definition. Pedal edema is a condition where extra fluid accumulates in the lower legs and the feet, causing them to swell. So this swelling can happen for several reasons, like heart problems when there are back pressure changes, or liver issues, thyroid issues, kidney issues, or even the blood clots. Our body fluids are divided into two main areas. We all know it: inside our cells and outside our cells. That is extracellular and intracellular fluids. The outside our area includes the space around our cells and inside our blood vessels. Edema or swelling occurs when there's a problem with how fluids are distributed between these areas. That is, when there is the movement of extracellular fluid into the intracellular fluid into the extracellular compartment, that is called as edema. And the pedal edema is the edema around these ankles. Okay. This problem can happen if there is too much pressure, if too much pressure builds up in the blood vessels, often due to heart issues. What is too much pressure? That is due to back pressure changes when heart is not able to pump the preload, and that creates the pressure into the veins, blood vessels, and that fluids then trickles out, or it exudates out from that vessels into the extracellular compartment. So again, what this problem happens when there is too much pressure builds up in the blood vessels. I have taken up why that pressure is building up, because heart is not able to pump the preload, and there is decrease in the afterload, often due to heart issues or excess fluid. It can occur if there are not enough proteins in the blood. Why? When there are not proteins, then then again it disturbs this concentration of fluids in the extracellular and intercellular compartment. We already know fluids, if from the equilibrium, that fluids move from the area where the salts are less to the area where salts are more. Same is with the albumin, like albumin, which helps keep fluid in the vessels. Additionally, the lymphatic systems normally help more extra fluids and protein back into the blood move. Okay. If the system is not working properly, fluid can build up and cause swelling. So why here this line has came like lymphatic system? So because in case of elephantiasis, we see, which is a parasitic disease, and we see so many beggars with swollen legs. That is not due to heart disease or this fluid overload. That is due to that parasitic disease, which we call as filariasis. So that is problem with the lymphatic system. So lymphedema, we call that pedal edema with a specific name, lymphedema. So that's why it has mentioned here, like additionally, the lymphatic system normally move mm, extra fluid and protein back into the blood. But if this system does not work properly, as in case of filariasis, fluid can build up and cause swelling. That is called as lymphedema. The kidneys play a crucial role in regulating the body's fluid balance. The kidneys help remove waste and regulate fluid. When they are not functioning properly, fluid can accumulate, leading to edema, as it is seen in the case of chronic kidney disease and acute kidney injury or nephrotic syndrome. Again, in case of nephrotic syndrome, what is the problem? Albumin is thrown out because these glomerular, this filtration membrane is not able to filter the albumin, and albumin comes out in urine, which we call as protein urea. Again, in CKD, same pathogenesis leads to pedal edema. Edema is one of the major symptoms of CKD. Yes, we all know that. And let's explore how we approach the diagnosis of edema. So we'll be rushing to generalized edema. What is generalized edema? Generalized edema is edema which is present all over the body, all areas of the body. So this affects the entire body or the large area and is often linked to the conditions such as heart failure, and kidney disease. What is localized edema? This type of edema is in a specific part of the body. It is often due to inflammation. How? When there is an injury, we all know the fluids from the intracellular compartment rush into the extracellular compartment with the cells and that fibrin and all the clotting factors to clot that area, and this stop the blood loss and all. We already know the process of healing. So in case of inflammation, to heal that area of the body where there has been an injury or any insult, that causes localized edema and blocked lymph fluid flow or issues with the blood flow in the veins. During a physical examination, we look for pitting and non-pitting edema. What is pitting edema? Indentation after pressure indicating heart failure or the nephrotic syndrome. Indentation after pressure. Okay, what is indentation after pressure? What does it mean? How we check the pedal edema? We this indent the area where the edema is present with our thumb for 30 seconds and see if there is formation of a pit which doesn't go away very fast. That is called as pitting edema. Where from this term pitting has come, because that pit is formed and it doesn't go away very easily. If I indent my this arm or a ankle area, it will be formed back, but it will be gone very easily. But in case of pitting edema, it's not gone very easily. That's why we call it as pitting edema, because pit is formed on indentation, on pressure, applying pressure with the hand. We do it normally in many cases, and non-pitting edema suggests there is lymphatic obstruction or hypothyroidism. Why lymphatic obstruction? I have already explained that in case of lymph filariasis, we see even if we apply the indentation because they have swollen eggs. We also call filariasis as elephantiasis. Why elephantiasis? Because they have elephant-like legs, swollen legs. So that edema is not pitting. No pit is formed even if you press it. In case of the renal disease, the following lab tests and images are of help. What are they? We can do CBC, complete blood count, renal function tests, including serum creatinine, urine analysis, urine albumin urea. If albumin is present, I have already explained because albumin is thrown out because glomerular filtration membrane is not able to stop the leakage of albumin into the urine, and the urine albumin to creatinine ratio, as well as the ultrasound of the abdomen and pelvis. A, what we see in this ultrasound of this abdomen and pelvis, like in case of these polycystic yeah, these kidney disease, we will see the cysts in the kidney, or if there is any stone which has led to the renal failure, or if there is any swelling in the kidney, or we have a very specific term like shrunken kidney. These we all will see the CT and all these ultrasounds. When it comes to managing edema, the approach depends on whether the cause is local or systemic. For local causes, non-pharmacological treatments are essential. For local edema, non-pharmacological measures are limb elevation. For example, whenever we are traveling in a bus or in a car and we travel for long distances, so many people are these exposed to swelling of their feet. Okay, so that edema is not due to any pathogenesis. That is generally due to long travel and hanging of the legs. So that's why that edema can be simply gone by the limb elevation. When you go home, take rest, place a pillow below the limbs and elevate your limb, it will be gone. Compression therapy. Wearing compression stockings can assist in improving blood flow. Physiotherapy, massage extra, ice application. So these are all non-pharmacological treatments. Now, what is the pharmacological treatment like in case of hypertension, which has led to the problem is in the heart, or there is a heart disease like valvular diseases, or there is CKD or acute kidney injury or acute on AKI on chronic CKD, whatever it is. Now we'll be taking of the pharmacological treatment. What's the pharmacological treatment? Salt restriction. Limiting salt intake helps prevent fluid buildup and manage volume overload. Diuretics. What are the diuretics? Diuretics are the drugs which help body lose more water into the urine and thereby helping the heart to improve the afterload. Now, loop diuretics, which we all know that loop of the glomeruli, it acts on the loop like furosemide and torocemide, very drug of choice for treating hypertension as well as CKD or even heart disease, often preferred for their effectiveness and longer duration of action. Thiazide diuretics use as a adjuvant therapy. Hydrochlorothiazide, potassium sparing diuretics like spironolactone, because what is the main side effect of the diuretics? Potassium loss. So these potassium sparing diuretics like spironolactone, they decrease the risk of hyperkalemia. The choice used cautiously due to risk of hyperkalemia. That means they reduce the risk of hypokalemia, but because they are potassium sparing, they can lead to hyperkalemias. The choice and the dose of the diuretics depend on the factors like severity of edema, patient's hemodynamic status, kidney function, and all. In chronic kidney disease, managing edema often requires salt and fluid restriction and high dose diuretics. Loop diuretics like furosemide are usually effective, but thiazide diuretics can be added if necessary. So they are the adjuvant therapy. First drug of choice is the loop diuretic, which are furosemide and toracemide. Managing edema involves a tailored approach for local causes and non-pharmacological causes. Systemic causes require dietary adjustments, diuretics, and close monitoring. Next. Yeah. Patient education is crucial. Understanding the condition, following the treatment plan, and maintaining lifestyle can improve outcomes. Why patient education? Because whenever you put patient on diuretic, he's going to urinate more. So you have to explain him that it will lead to the loss of fluids from the body and thereby decreasing the edema and increasing the afterload and managing the preload, thereby decreasing the workload of the heart. So what is the target of a clinician is to manage the fluid load of the body so as to make the heart work better and thereby managing the workload of the heart, decreasing the workload. More is the preload, more is the stress on the heart. And less is the preload, less is the stress on the heart. And if the preload is manageable for a failing heart in case of CHF, so it will be able to contract and generate the afterload very well. And if preload is very high, then heart is not able to work well, and there is edema and all the back pressure changes like we see pleural effusion and all. So early recognition and effective symptoms management help prevent complications. So what is the take-home message? I think this is the last slide. Take-home message is we dealt with the edema. There are two causes for the edema. That is systemic diseases or the local diseases. Local diseases are injury or any insult to the tissue, and the systemic diseases are heart diseases, hypothyroidisms, and kidney diseases like AKI and CKDs. And then also we have a lymphatic system disease or filariasis and elephantiasis, which leads to the blockage of a lymphatic system and there is a lymphedema. Okay, so edema can be generalized and it can be local. So the generalized edema are in case of the systemic diseases like heart disease and the kidney diseases. How we have to deal with them? We are have three choices for the diuretics: loop diuretics, thiazide diuretics, or potassium sparing like spironolactone. What is the drug of choice? Toracemide and furosemide, like Lasix. So I just inquired before taking up this session that which new drug has come. So they have just made me know that they have launched a MD, mouth dissolving loop diuretic. So the diuretics which act on the loop of the glomeruli, they are more effective than the thiazide diuretics, which can only be used as adjuvant therapy in case of edema. So pleural edema we have taken up lymphedema, and these diuretics are not of any use in case of lymphedema. Why? Because process is different, pathogenesis is different, and we have a DEC drug there, which we use in case of elephantiasis or filariasis. So there's a note, join us in recognizing National Edema Awareness Day on September 25th to increase awareness and promote early detection of edema and related symptoms. Together we can manage and understand edema better. Thanks for watching. Thank you. I think I have taken up session. I have done justice to these slides. Okay. Ditor MD. The drug which has come is the Ditor MD.